Processed foods linked to multiple health risks. New study reveals alarming findings. According to a recent study involving nearly 10 million people, consuming ultra-processed foods significantly increases the risk of developing or succumbing to a multitude of adverse health conditions. These conditions span a wide range, including cardiovascular disease, obesity, depression, and more. It's a stark reminder that our dietary choices play a crucial role in our overall well-being. The article Ultra-Processed Food Exposure and Adverse Health Outcomes, Umbrella Review of Epidemiological Meta-Analyses, provided research that concluded greater exposure to ultra-processed food was associated with a higher risk of adverse health outcomes, especially cardiometabolic, common mental disorder, and mortality outcomes. These findings provide a rationale to develop and evaluate the effectiveness of using population-based and public health measures to target and reduce dietary exposure to ultra-processed foods for improved human health. They also inform and provide support for urgent mechanistic research. Previous research finds that more than half the calories consumed in the average American diet comes from ultra-processed foods, a factor that can contribute to more obesity and other health conditions like heart disease and diabetes. A study, published by the online journal BMJ Open, analyzed the diets of more than 9,300 children, teens, and adults. It found that ultra-processed foods made up near 60% of all calories consumed and nearly 90% of caloric intake from added sugars. Ultra-processed foods contain several semi-processed ingredients such as oils, flours, sugars, sweeteners, and salt. Some of the most popular of these foods would include sugary drinks like soda and other ready-made foods like frozen pizza, hamburgers, chips, cakes, and candy. Last year, a joint study by the Pan American Health Organization and the World Health Organization found that the increased consumption of ultra-processed food was a major driver of growing rates of overweight and obesity. It said they were doubly harmful and quasi-addictive as they are engineered to have long shelf lives and to create cravings that can completely overpower people's innate appetite control mechanisms and their rational desire to stop eating. The WHO recommends a sugar intake of no more than 25 grams of sugar per day. Experts say decreasing the consumption of ultra-processed food could be an effective way of reducing the excessive intake of added sugar in the U.S. A new study finds that more than half the calories consumed in the average American diet comes from ultra-processed foods, a factor that can contribute to more obesity and other health conditions like heart disease and diabetes.